Good morning. Some of you might not be morning, maybe very late at night. Thank you for joining me. This is Dr. Carrera. I wanted to go through with you understanding a deeper part of depression and anxiety from recognition to treatment. And if this is for yourself or someone in your family you feel is suffering, you can learn from the signs, the symptoms, and then also the treatment plan with this quick webinar. I will answer questions later on. If you guys want to put some in the comments or just reach out to me personally, that's perfect. So to start off, last week, we were joined by Lillian Ingram. She is nurse practitioner, board certified mental health and also family. She's fantastic. She was an excellent resource and podcast to listen to if you would like to expand on the depression and anxiety. If not, you can follow along here. Okay, so let's get going. Depression and anxiety, just the overview. Everybody wonders, okay, I'm having a bad day. What is the actual definition in the DSM-5? What will contribute to being diagnosed as depression, to have depression or anxiety? And we're going to get some definition reflections here. So first thing, depression and anxiety, they're the most common mental health conditions that can affect daily life, relationships, and overall well-being. We know this, we see it. Sometimes it comes out as just people sleeping a lot or being more lazy or gaining weight. They're actually depressed. Anxiety, you'll see very quick tempers. You may see just people, they get overwhelmed very easy. They're starting to have panic attacks. They won't want to come out of their house. They feel that they can't attend social events, so on and so forth. So to start off, depression is a mood disorder, and it's characterized by what we all see as hopelessness, sadness, a loss in interest in doing things, especially stuff that people used to enjoy in the past. It usually affects sleep. Definitely people can't sleep or they're sleeping too much, appetite, energy levels, and concentration. The signs of depression, feeling sad most of the day. They just feel like they don't have control. They have the fatigue, they feeling worthless or guilty. And this will last for more than 2 weeks. So if it's a trying event, if someone's going through a divorce, if there's a big move, if they were let go of their job, there's a life-changing event, this is normal and not necessarily thought to have to get on medication, but more just to process and to have guidance, support, therapy. Anxiety, on the other hand, is a condition that is marked by excessive worry, nervousness, and fear that it's difficult, that they can't control. It's when you're out of control, you feel that it's too much, it's overbearing. Also, you start to retreat or decline social events. You feel like your heart is going to beat out of your chest. It could be that you're going to have to speak in front of a whole bunch of people. So again, if it's just occasional and incidental, then it may not necessarily be an anxiety disorder. It just may be you get a little nervous before giving presentations, or if you have to go somewhere or start a new job. So anxiety, the definition is that you're supposed to have it more than 6 months before you're treated, which I think in itself is a little absurd. By then you're developing major ulcers and been to the hospital twice thinking you're having a heart attack when really you're just having a panic attack. So it can be diagnosed as adjustment disorder and treated way before the 6 months. Again, the signs of anxiety, the racing heart, the sweating, the stomach issues, the IBS. You can get tension headaches. A lot of times you cannot sleep. Think about when you have something due at work or at school, or your kids are sick, or you're worried about finding a job, money. So it affects you in every way. Depression and anxiety, we do screen for those. And I'm sure you guys have gone into your provider's office and they give you this 2 questionnaire thing to fill out. They really, unfortunately, don't interact and ask one-on-one, how are you doing or how are you feeling? We're hoping that someone will come forth, but a lot of times people are just more introverted and quiet about it. Myself, and my practice are trying now to really identify and bring up, hey, depression, anxiety, let's talk about it. Let's get you to your optimal health. So screening for this will prevent worsening symptoms, and it definitely supports a earlier recovery, and then your quality of life improves. So there's two different screening tools you guys will see. There's a depression PHQ-2, and that's only 2 questions. And that's the one that's usually given out when you go into your doctor's office. Or there's a PHQ-9. The 9, it has the 9 questions addressing little or no interest in doing things, feeling down, depressed, feeling tired, hopeless, poor appetite, trouble concentrating on things. And the last one of thoughts you would be better off dead or hurting yourself in some way. So right away for you yourself, if you're thinking this way, or if you have a family member thinking this way, you need immediate help. I'm going to leave. There's a crisis hotline for you to call for yourself or family member, and ASAP, they will help you and get you the right service treatment, whatever you need. So there's a number system and there's a score. And from there, you will be assessed to see what form of treatment you need with the depression PHQ-9. And then also we'll ask you, hey, are you having any life-changing events, such as a divorce? It could be a child going away to college, empty nest syndrome, right? Losing a job, so on and so forth. The anxiety scoring form is a GAD-7. That's the general anxiety disorder 7. That has 7 questions, and it's along the same lines of anxiety, worry, restlessness, trouble relaxing. Is it hard to sit still? And not like the normal sit still where you're waiting in a waiting room and your leg is jumping up and down. It's more of you're just irritable and you're up and down, you're nervous, you're anxious, you're edgy. That's what those questions are. So first step in treatment is non-pharmacological care, or this would be more of a cognitive type therapy. It's for mild symptoms of either depression or anxiety. And it begins with non-medication strategies. Number one thing I always push is exercise and sunlight. Because when you're depressed or when you're anxious, one of two things: you're not having enough serotonin, you're not having enough dopamine, you are overproducing like the fight or flight. You get that adrenaline when you're anxious and you overproduce it, and it has nowhere to go. So that's why your heart rate increases. You become anxious. It's just like if you're running from a dog or you're in a race, you have to expel that energy. So exercise is huge, and sunlight, that brightness, the vitamin D just wakes up your overall feeling good and it empowers you. So there's cognitive behavioral therapy. CBT is the acronym for that, and that helps reframe negative thoughts and build healthier coping skills. I've talked about this with Lillian Ingram and also Carrie Flores, maybe to adopt a gratitude practice and to just think every morning, every evening, 3 different things every single day, what you are thankful for. It could be as simple as, my hair is growing back in, or I had enough money to buy a new couch or something, or I had a great breakfast this morning, or I wasn't as fatigued this morning. Mindfulness, this is meditation, support, relaxation, focus. There are apps that you can get to do this, because I know my mind goes back and forth. I will try and meditate or get into those cold plunge or cool water baths that you're supposed to sit and kind of enjoy, and my mind goes everywhere. So I need more of an app to kind of guide me. So those are great. And then I put a lot of emphasis on this one is social connection. Spending time with others reduces isolation, of course, but it also gives you the support for you to talk about what's going on. And even though you think you can process it yourself or you don't want to talk about it, it's imperative and important to let others know that you're having, some downtimes, you're struggling, some issues. It can make your day, make or break your day. Somebody brings you a cup of coffee. Somebody comes over with dinner. Somebody just calls you and checks on you. It lightens your mood. How many times have you not wanted to get up in the morning and you knew that you had to get your kid to school? And it was because your kids got you up and you had to go take them, or you had to be at work. You did not want to go. But once you got there and you got around others, your whole mood changed. So think of it that way. Now, when symptoms are moderate to severe, this is when the cognitive behavioral therapy, that lifestyle change and medication at it is going to be more effective than just a cognitive therapy itself. We will use both of those together so that you have lasting symptom control. So with depression, first line medications, a lot of people are very familiar with Prozac or Paxil or Zoloft. They hear these. So SSRIs, they're selective serotonin reuptake inhibitors. And you may see people in your family or friends, or just remember the words Trelean, fluoxetine, citalopram. There's the Lexapro, which is escitalopram. These are very common. They do not define you. They will just help you get through this stage, this chapter of your life, and know that once you start it, for it to be most effective, you are to stay on it for 9 months. Even if you feel better after 3 months, you don't want to get off of it. You want to wait the full 9 and then titrate off. Side effects can be gastrointestinal upset. It could be a little bit of weight changes. But the biggest I hear is the sexual dysfunction. And Lillian Ingram agreed with that. She actually emphasized that. That's the biggest one. Second line for depression, if those do not work, is SNRI, serotonin, norepinephrine reuptake inhibitors, and duloxetine. Venlafaxine is just examples. Other atypical antidepressants you may see is bupropion or mirtazapine. Helps patients sleep. When I was in long-term care or people were in the hospital, this is great for them to sleep, but also when they're not eating. So this will help increase the appetite. Common side effects, of course, the gastrointestinal possible side effects may get a little bit of a headache, sexual dysfunction, and we have to watch for blood pressure. So anxiety, first line medications, the SSRIs, SNRIs, and then the other ones are the buspirone. They're non-sedating for long term. I like to prescribe hydroxine. This is great for acute relief. If you're going to go in front of a large group to give a speech, or if you just can't sleep, this is great. There's also, believe it or not, in the category of blood pressure medications, propranolol, people ask for a lot, or this is prescribed commonly from a primary care provider aspect. And that's again for just acute calming down situations, such as having to be in front of large crowds and speak. Benzos, I don't prescribe those. They are controlled to the point where you can develop a dependence on them. So those would be handled more by a psych practice. So if still after 3 different medications, yourself or a person in your family, a friend, they're not reaching their ultimate effects, and the depression is really still very, very heavy. It has to be pretty heavy. And the anxiety, there is other options. Lillian Ingram, nurse practitioner, talked about this, the TMS, the transcranial magnetic stimulation, and the Spravato, and that's the esketamine nasal spray. Those are both done in the office. They're quick. They don't take very long. And I will leave Lily information, a Learning to Achieve Wellness, if you want to learn more about that. It just tells a little bit about it. The podcast was great. If you guys want to get more information, if you did not listen to it in the first place, this is fantastic. We go in depth with it. It's great. Same thing with the Spravato. So putting it all together, when you come to me and my practice, and this should be at any primary care practice, you should have a screening for PHQ-9 or 2, the 2 questions, or the GAD-7 if you're asking for a refill on your medications, because you can have been on them for a very long time and you do well on them, and it's just for maintenance. That's totally fantastic. Great. There should be a baseline. Or if you're new to the practice, or every checkup when you go in there for your annual, or every 6 months, they should give you these questions to see if there's been a lifestyle change or anything has developed. And after that, you will be assessed and just asked questions. And we will see if it's lifestyle measures you need and a little bit of therapy, or if we need to go a little bit further with a pharmacological advanced therapy. Again, early recognition and the right treatment plan will make situations diffuse quickly and also your recovery fast. So, important key points. Medication takes 4 to 6 weeks. These type of the SSRIs and SNRIs, they take 4 to 6 weeks to kick in. So you may not feel well after a week still. Hang in there. You need to have the therapy with it. You don't want to stop abruptly. You may have a little bit of headaches with them. If it's not the right medication, then talk to your provider and see if we need to titrate you back or change the medication. And you want to avoid alcohol and definitely recreational drugs on top of it. So the cannabis and anything else on the side. There are social events, especially with the holidays coming up. A drink or two of wine or champagne or hard liquor. I understand it's the excessive alcohol. It can make your symptoms worse. So this is just a table summary of the treatment plans, the non-pharmacological options, first line, second line, other options, and then side effects you guys can look through. Just to kind of encompass everything we talked about with the depression and anxiety. And if you have a history of it, there's a history in your family, and you really are feeling down and out, we will 100% address this, but I'm going to broaden it a little bit for you. Some patients come to Carrera Telehealth and Wellness experiencing chronic fatigue, experiencing a lot of inflammation in their joints, in their body. They are a little overwhelmed and depressed. They're trying to get pregnant. So there's infertility, there's PCOS. Men, they're going through transition. If they do shift work, a lot of firefighters and law enforcement have low testosterone because they work overnight and they're switching shifts, or it could just be somebody in the medical field. Weight, if you have weight concerns, you're overweight, you can't get it. It could put a damper. It could be a damper on your life in general, just every day. If you're feeling overwhelmed with this, we can talk through it. We can see if it's truly depression, anxiety, or it's just a life change we need to do. We can address treatment options for the chronic fatigue. There's GLP-1s that will help with the inflammation, infertility. There's low dose naltrexone. There's medications such as letrozole, PCOS, again, metformin, or we can go with the GLP-1s. Low testosterone, there's testosterone replacement options, weight concerns, real big on the GLP-1s. They're fantastic. I'm going to go and talk more in depth next week about eating disorders. And we can get a little bit deeper into that, but that's frustrating. That definitely impacts daily lives. So we offer different routes to help besides pharmacological standard medications. My goal is to help restore balance, overall wellness, guys, improving your energy, supporting you in your fertility endeavors. Want 1, 2, 3, 5 kids. You want to just feel not arthritic. You can be in your 60s, 70s. I even have patients in my 80s that come in. They want to be able to go for a walk and go for a hike. I'm here. You could be in your 20s and you're overwhelmed with school and bills and you don't know what to do, where to go, and how to start that healthy lifestyle and sustain it. Tons of peptides. They're natural. They're fantastic. I take them myself. They work really well. Now, if you need, again, immediate support, there is the NAMI HelpLine. The phone number's here. You can text HelpLine to 62640. You can chat online. Here's a phone number to call for crisis. You are not alone. There's always help available. Reach out, call your friend, call your loved one. Don't hesitate. So again, going back, not everyone with low mood or fatigue has depression or anxiety. Sometimes it's simply just health challenges, circumstances, and recognizing these barriers, having somebody, licensed health provider, to talk about this with you can help you take the first step towards change. So it could be you're struggling with brain fog or poor memory. You can feel just very drained. And again, it could just be life circumstances, right? You're going to work, you're trying to pick up a class, but that you have to go get the kids, or you have kids and they're all in these sports and you're working and you're trying to cook and there's laundry. Do you feel frequently just lethargic overall? We can do labs. I'm going to do a set of labs on you. You can be anemic. We can check your thyroid. Why is your hair thinning? Why you're noticing muscle loss, even though you're trying to work out? Do you experience low libido? Is it because your circadian rhythm's off? Is it because your hormones are off? Is it menopause? Do you have low testosterone? We will address all of that. Or a lot of my patients have been doing fantastic on the GLP-1s, but now you've plateaued and you're noticing slowly that weight is starting to creep back on. How do we handle this? Reach out. I'll go over your options. We'll look at everything. You are an individual, so I will treat you and your circumstance as an individual. I don't have a template. It's per person and it's very distinctive. Again, first thing I want to tell you this morning is go for a walk, or even this evening, go for a walk. When you come back, or even on your walk, listen to a podcast and then do your gratitude practice. If you've answered yes to any of these questions and you would like to move forward, you can go onto yourvipdoctor.com and there's a little tab that says get started here. I will be waiting. My staff, my nurses, nurse practitioner, we're all here for you. Thank you guys. I hope to hear from you soon. Chin up. Let's keep it going. And you can listen to my podcast on Gloved Up and Scrubbed In. It's on YouTube, Spotify, Facebook, IG, and TikTok. It's all over the place. All right. With love. Talk to you guys later. Dr. Carrera.